Artificial intelligence can now answer questions, explain complicated concepts, generate clinical scenarios, and provide feedback almost instantly. So here is an uncomfortable question for education. Do we still need the teacher? Or, more specifically, could an AI system actually facilitate the kind of discussion and problem-solving that university students normally do with an experienced academic? A recent study from Pakistan tested exactly that question, not through opinions or predictions, but through an experiment involving final-year dental students. And the results are fascinating. Because when it came to test scores, AI performed surprisingly well. But when researchers asked students about the actual experience of learning, a very different picture emerged. The study focused on case-based learning, commonly called CBL. In case-based learning, students are given realistic clinical problems and asked to work through them. Rather than simply memorizing information, they have to ask questions, interpret evidence, consider alternatives, and decide what they might actually do with a patient. This kind of learning is particularly important in medicine and dentistry because professional practice rarely involves perfectly straightforward problems. Normally, an experienced teacher facilitates these discussions. But there is a practical problem. In many education systems, including Pakistan, institutions may have large numbers of students but relatively few trained faculty members available to facilitate small group learning. The researchers therefore asked, could artificial intelligence provide some of this facilitation? And if it could, would students learn as effectively as they do with a human teacher? The researchers recruited 16 final-year Bachelor of Dental Surgery students at Liquid College of Medicine and Dentistry in Karachi. Now, 16 students is a small sample and we will come back to that later. But the researchers used an interesting experimental design. The students were randomly divided into two groups of 8. One group initially completed case-based learning with ChatGPT 3.5 acting as the facilitator. The second group completed the same type of learning with a human facilitator. Then, after a 1-week washout period, they switched. So students who had initially learnt with AI were taught by a human facilitator, and those who started with the human facilitator experienced the AI version. This is called a randomized crossover design, and it allowed the researchers to compare the two forms of facilitation while giving both groups experience of both conditions. The clinical cases concerned oral and maxillofacial surgery, and students completed tests before and after each learning session. Afterwards, researchers also conducted focus groups to understand how students experienced the two approaches. So this was not simply a study of test scores. It examined both what students learnt and how they experienced learning. And here is where things become interesting. Students improved significantly after both types of teaching. Whether the facilitator was ChatGPT or a human teacher, students' post-test performance improved. More importantly, when the researchers compared post-test scores between the AI-facilitated and human-facilitated groups, they found no statistically significant difference. Following the crossover, median scores were 28.5 for students learning with AI and 26.5 for those learning with the human facilitator, but again the difference in post-test performance was not statistically significant. So, if we judged teaching purely by these immediate assessment results, the conclusion might sound dramatic. AI appeared capable of producing learning outcomes comparable with those produced by a human facilitator. But this is precisely where the qualitative part of the study becomes important. Because education is more than whether somebody gets a few more multiple-choice questions correct after a lesson. When researchers spoke with the students, they found that AI and humans were providing different kinds of educational experiences. Students appreciated several things about AI. It was systematic. It provided structured guidance. It gave rapid feedback. And some students felt more comfortable asking questions because interacting with AI could provide a relatively judgment-free environment. The researchers also found that AI performed particularly well in supporting factual learning and structured analytical thinking. But students repeatedly identified something AI struggled to reproduce: human responsiveness. A teacher can notice hesitation. A teacher can recognize confusion from somebody's expression. A teacher can change an explanation halfway through because the class clearly has not understood it. And a teacher can bring professional experience, emotion, humor, encouragement, and empathy into a discussion. Students felt that AI interactions could sometimes be mechanical. It could structure the conversation, but it could not always recognize when students were struggling. Human facilitators, by comparison, were perceived as stronger in emotional engagement, adaptive questioning, and clinical reasoning. And in professional fields such as medicine and dentistry, that distinction matters. Clinical education is not simply about knowing the technically correct answer. Future healthcare professionals must learn judgment, communication, empathy, and how to respond to complex human situations. There was another interesting finding. Some students described AI as a space where they could ask questions without worrying about being judged. That is potentially significant. Students sometimes remain silent in classrooms because they fear asking what they think might be a basic or embarrassing question. An AI tutor does not become impatient. It does not laugh. And it does not make a student feel embarrassed in front of classmates. So AI may create opportunities for self-directed practice and reflection that complement classroom teaching rather than replacing it. Of course, the AI experience was not perfect. Students reported technical difficulties. Sometimes the system misunderstood questions or did not respond as expected. They also had to learn how to communicate with the AI effectively, essentially learning how to phrase their prompts. So using AI effectively itself required a degree of learning and adaptation. So what does this experiment actually tell us? Certainly not that AI has made teachers unnecessary. A more defensible conclusion is almost the opposite. The study suggests that AI and human teachers may have different educational strengths. AI can offer consistency, availability, rapid feedback, and structured practice. A human educator can provide context, empathy, professional judgment, responsiveness, and mentorship. And that leads to perhaps the most important finding of the study. Students themselves tended to favor a hybrid model. Rather than asking, should AI or humans teach students? Perhaps the better question is, which parts of teaching can AI support, and which parts should remain fundamentally human? That is a much more interesting conversation about the future of education. There is, however, an important reason to be cautious. This was a small study involving only 16 students from one institution. The intervention was also relatively short, and learning was primarily assessed using multiple choice questions. That means the study cannot tell us whether AI and human facilitation would produce equivalent results over an entire semester. It also cannot establish whether students would perform equally well in actual clinical practice, retain their knowledge equally well months later, or develop comparable communication and professional judgment. The authors themselves recognize these limitations and call for larger, multi-center and longitudinal studies. So perhaps this experiment does not tell us that AI can replace teachers. Instead, it tells us something more useful. Good teaching contains multiple components. Some are informational. Some are cognitive. Some are social. And some are deeply human. Artificial intelligence may increasingly handle the first two remarkably well. But education, particularly professional education, also depends on relationships, judgment, empathy, and the ability to understand another person. For now, the future suggested by this study is therefore not AI versus teachers. It is AI with teachers. And perhaps the institutions that learn how to combine the strengths of both will create the most powerful learning environments. What do you think? Would you be comfortable learning from an AI tutor? And if you are a teacher, which parts of your teaching would you happily delegate to AI, and which parts would you never give up? Let me know in the comments. And if you're interested in research about education, artificial intelligence, and teaching, subscribe for the next video.